Have you or your staff ever been cursed at, abused, slapped, hit, punched, sexually assaulted, or stalked by a patient or other staff member? Have you ever experienced the trauma of a physician or colleague on the medical staff being killed? Have you ever been involved in a workplace mass shooting, hostage situation, or a bomb threat? If yes, you already know these are horribly traumatic experiences which not only affect you, but also frighten and demoralize your staff and your organization. Have you or your organization ever had your workplace environment assessed to make everyone safe, or had a serious violence prevention training? Police or hospital security can be very helpful, but they always arrive after the violence has occurred. This means that you, your staff, and your organization need an environmental safety assessment and remediation plan and/or violence prevention training. Hi, I am Dr. Robert Feinstein, professor of psychiatry and a violence prevention expert. I've had way too much on-the-job training for violence prevention in a wide array of medical and corporate settings. I trained at NYU as a physician, was director of psychiatric emergency services at the Albert Einstein College of Medicine. I taught violence prevention at Columbia Presbyterian Hospital, as well as worked on violence prevention with Connecticut's State Crisis Intervention Services. I have worked with emergency rooms for 10 years, worked with police force and hospital security in Connecticut, New York, and Colorado. I have also worked with community mental health and addiction services, outpatient settings for maternity, psychiatry, dentistry, orthopedics, and primary care. I've also worked in corporate settings. The most difficult and tragic experience I ever had was working with staff before and after the Aurora Theater mass shooting, where 12 people were killed and 72 people were wounded. It's unfortunate, but workplace violence in a hospital and outpatient setting is on the rise. Some truly frightening statistics. 9 to 25% of healthcare staff experience verbal aggression or assault from patients each year. 100% of nurses, I repeat that, 100% of nurses have experienced aggression or violence from patients every year. 33 to 56% of psychiatrists and other mental health professionals have been assaulted at least once during their career. The most dangerous locations for violence are in the emergency room, on a geriatric service, at hospital pharmacies, and at all of psychiatric and addiction services. There is almost no data on assaults in outpatient practice settings. However, if you ask colleagues or listen to the news, this is a major, under-recognized, and devastating trauma-inducing problem. I can offer you and your staff or organization part or all of a 6-part violence prevention program. This can range from assessing the safety of your workplace to helping your organization develop an emergency preparedness plan and develop de-escalation training for your staff. Already, a number of organizations have brought me in to develop experiential threat simulation trainings for mass shootings, hostage situation, and bomb threats. I invite you to schedule a complimentary 30-minute clarity call with me to assess your violence prevention needs and suggest a plan and a possible and practical way to proceed. Email me at Feinster, Feinster, at robfeinsteinmd.com. Call me at 303-815-6934 or visit my website, robfeinsteinmd.com. I look forward to connecting with you.